Foundational public health services are a core set of services that public health, both state and local governmental health, would provide in communities, and for which no community should be without.
This is really looking at those things that need to be present in every community in Washington, and they're provided by government. They're not provided by a private industry, they're not provided by healthcare, they're provided by your public health partners, whether that be local, state, or tribal.
I think it's important to do this now again at this time for a number of reasons. One is we've been doing this looking forward to what public health is, where we need to be going, and our role has been changing a bit over time. We're focused a lot more on chronic diseases. We're focusing a lot on our assessment work and how that leads to policy and the policy development work we do, and healthy communities work. So our work has been changing over time, and we wanted to make sure that the core services are really fitting for what today's needs are. Then you add on to that many local health departments especially are really hurting for funds. They've cut a third, a half of their staff over the last 5-10 years.
Everybody has seen their resources go down, their inability to meet some of the things that we think are really important. Public health, it's our obligation to the citizens of Washington, and when we can't meet that obligation, that's not a good feeling for people who are passionate about public health.
People gave of their time when nobody was really getting specifically paid to do that, but folks knew it was our future and came together like we do often in public health in our state, where state and local folks come together for the common good. So I'm really proud of that.
Things that I'm really proud about too is there's a national initiative going on foundational public health, and the work that we did in Washington has heavily influenced that initiative. In fact, the definitions for the national are very close to the Washington definitions, as are the ones they come up with in Oregon, and our work is being used across the country, and so we're proud to have been able to influence that level of work and have people recognize what we've been doing as exceptional.
Again, we've got Washington people doing Washington stuff who are then sitting on national committees, sharing what we're doing and influencing that, and then the product of the national group looks very much like what we've been doing in Washington.
To sell this work at a policy level, it's not going to work for public health people to get up and say how important this is. We need our stakeholders to say, we need public health. And we need what the government provides us, and it's really important to our health and safety and quality of life. This work is really fundamental to the future success of governmental public health. If we don't fund public health in a way that provides the capacity to protect all of the people who live in Washington, then we're not going to be successful.
Well, I would say foundational is the water you drink, the food you eat, the air you breathe, the communities you live in, to have safe communities, being able to get around a community. It's about healthy lifestyles. That's core public health, and that's the core foundational services. They're the services that people expect to be delivered, that many times they don't even think about, but they count on it every single minute of every single day.